work. Today we will be dealing with antiseptics and disinfectants. Have you heard these terms, antiseptics and disinfectants? Yes? Where we are using these antiseptics and disinfectants? Do you know any other terms related to this? Sterilization, pasteurization, decontamination, all these things are there. Okay, what is the difference between this antiseptics and disinfectants? Is there any difference? What is the difference? Yes? Antiseptics can be used on the body surface, but disinfection will be for the inanimate things. Okay, so today we are learning the terms related to this antiseptics and disinfectants. You should be knowing because most of the nursing staff are involved in this antiseptics and disinfectants. So the primary goal for this treatment is disinfection. Okay, that's what cures many of the diseases, whether in operative wards, post-operative wards, anywhere. Okay, so the common term for this antiseptics and disinfectants is germicides. Okay, germicides is the chemical method. Okay, so germicide, these are the antimicrobial used for chemical methods of disinfection or antiseptics. So this disinfection and antiseptics, they are both related terms. Only for that, disinfection is for the whole inanimate objects also. For example, tables, stools, surgical instruments, all these things. But antiseptics we are using for the bodily surface, maybe wound, cut, before operation. Okay, that side clear, before operation side clearance, all this we are using the term antiseptics. So have you heard of this word sterilization? Sterilized gauze, sterilized bandage material. Okay, you might have seen the bin containing, all the cotton material, all these things. Okay, so that is sterilization. What is decontamination? Decontamination of wound. For example, you get a road traffic accident. Okay, first there will be what? There will be mud on the wound. Okay, so on that wound we need to clear the wound first. Okay, that we call it as decontamination. So then we have sanitization. Okay, so every day before the patient gets admitted, the room should be sanitized. Okay, now what is the difference between this sanitization and disinfection? Because disinfection is also for the food, sanitization is also for the food. What is the difference? Disinfection may be for the instruments also. Okay, sanitization per se, we use it for a complete room like that. Okay, have you heard of this term pasteurization? So pasteurization is a common used for the milk. Okay, because they are worried about the bovine tuberculosis or any other diseases which can be transferred from animal to humans, because the milk we get is from the buffaloes or the cows. Then we have the term preservation. Preservation of the stored food. Okay, so have you seen pickles, for packet pickles, packeted food materials, cakes, biscuits, everything will come to. So for preservation we can use acetic acid, so many things are there. Okay, so coming to the definition of each of these terms. Okay, so the first term we need to understand is disinfection and antiseptics. Okay, so we have told that disinfection can be for the inanimate objects and this antiseptics is for the animate objects or the human skin, all these things. So what is the term here? Okay, those are the germicides or the chemical substances which are used to destroy or inhibit the growth of pathogenic vegetative bacteria on inanimate or the non-living surfaces such as glassware or surgical instruments. Okay, so here we are speaking about the instruments. The medicines or the drugs which we can use here are the formaldehyde, phenol, ethyl alcohol and soap. So commonly we have seen these phenols and ethyl alcohol in our setup. So then coming to the term antiseptics. So what is the common liquid we use in the homes? For Dettol. Then the newer one is Savlon and Dettol. Okay, you can also use alcohol also. So antiseptics are those germicides or chemical substances which are used to destroy the pathogenic bacteria, not the spores. Okay, so you need to remember the spores means the bacteria which has covering around cell. Okay, what these bacteria do? They cover themselves with the covering so that they are not exposed to this antiseptics or any chemicals which will kill them. Once there is favorable atmosphere or they enter the human jail tract, then they can uncover that and come out. Okay, so the antiseptics may not be able to penetrate these spores. So for that we have newer ones that we will be learning in the next class. Here, sterilization. Okay, for sterilization, it may be the oval, it may be the chemical sterilization, or it may be the what? Any other instrument you have seen? Have you seen autoclave? Yes, autoclave can be used for sterilization. So that's the time period which can kill the spores also. Okay, to use this for longer time or specific period of time, we can also kill the spores. In the process is the process that kills the living microorganisms, spores, viruses and fungi. Most types are covered by our sterilization. Then we have this decontamination. Okay, means marked reduction or restriction of the viable pathogenic organism to a level which will allow healthy persons natural defenses to prevent any infection. Okay, so that wound debridement is done completely. Even though we apply the antibiotics, topical antibiotics there, the first process what we do is decontamination. Decontamination itself can help the host defense system to fight against this bacteria. Okay, then we have the sanitization. Okay, this is the term for general sanitation. That means the municipal authority of each city will be taking care. Okay, so that's why we have the term here, public health department. Okay, means reduction in microbial load from an inanimate surface to a level set forth by public health department. Okay, so the public health department will take care of this sanitization. So what are the measures taken by this public health department? Have you seen anything? What the municipalities people will do to the drinking water? What do they add? DDT. Have you heard of DDT? So the DDT is for mosquitoes. Okay, any water bodies are there, any complete contamination is there in and around the house. Okay, where in the street ends, where most of the people will put the dust. There we need to put DDT in order to sanitize the water bodies and all. Can we add chlorine to the water? Yes, that's why the drinking water or the sweet water which comes to our home through the pipes, they have some peculiar taste. That may be due to the chlorine which they have added. Okay, so that can kill the bacteria. That is what is done with sanitization. Then we are coming to the pasteurization. Okay, do we really do this? 30 minutes, 60 to 80 degrees centigrade. Most of the time we may not do it because after you will be filling the complete bowl, and once the bowl will be fat tissues, fat substance will collect on the surface, you just switch off. But this should not be done. Okay, you should keep the low flame, and it is done for 30 minutes, minimum of 40 minutes you need to do. The temperature is about 60 to 80 degrees. We cannot keep the thermometer and check everything, but best thing is to put the low flame and do it for at least 30 minutes. Okay, so that can kill the spores also. Okay, so process of heating milk or other liquids or semi-solids for about 30 minutes at 60 to 80 degrees centigrade, which kills the non-sporulating microorganisms and prevents the growth of foodborne pathogens. So even by heating the milk, you can keep the milk only for 1 day, not more than 1 day. If you have to keep it more than 1 day, what is done? What will be the nature of the milk you get early morning from the packets? It will be very cold. Why it is cold? Because they have kept it at very low temperature, maybe 2 to 4 degrees centigrade. The cold chain they maintain. If you maintain the cold chain, if the milk can be kept up to 1 week or more. So the drugs which can be useful for this antisepsis. Okay, we have understood the terms antisepsis, disinfection, decontamination, okay, sterilization, pasteurization, all these things. You got to know there are various terms and specific terms have specific meaning. Okay, now we will try to understand what are the different chemicals we are using here. The main thing what you know are the commonly used ones are the aldehydes, phenols, alcohols and heavy metals. Okay, from aldehydes we have this formaldehyde and butyraldehyde. Butyraldehyde commonly used for surgical dip method sterilization. Okay, I have seen the surgical instruments in a tray where they are dipped into some fluid. Okay, that is butyraldehyde. So then we have this Cresol, Lysol, chlorine. Okay, these are phenols. Okay, these can be corrosive to the surgical instruments. These are mainly used for the mopping the floors. Okay, so phenol, you might learn phenol for mopping the floor. Then we have alcohol. So where do we use this ethyl alcohol? Most commonly for the wound dressing. Okay, ethyl alcohol and isopropyl alcohol. Okay, silver nitrate. Have you heard this silver nitrate eye drops, silver nitrate? Eye ointments are available. Okay, so zinc calamine. Okay, zinc. Have you heard of this zinc? You know, zinc is a popular astringent which has varied uses now. Or contains zinc. Antibiotics they have now put along with zinc because they have the astringent property. Okay. So and nowadays they are using zinc preparation for better growth of hair, and now most of the calamine lotion. Have you heard of this lactocalamine lotion? Yes? Yes. So this lactocalamine lotion also contains zinc. Okay. So it has a moisturizing effect also. So next is the drugs which have the action on the bacterial enzymes. Okay. So the drugs which act by complexes in the sulfhydryl group of bacterial enzymes, we have mercurial antiseptics. Okay, those are mercurochrome, nitromazole, chlorophores, that is chlorinated lime and chloramine-T. These chlorinated lime and chloramine-T they are used for water disinfection. Okay, so water disinfection. This is how the municipality people or the public health department they will purify this water. Okay. Then sodium hypochlorite iodophores. Have you heard of this iodine ointments? Iodine ointment have you seen? What is the color? Brown color. Okay. So brown color. This is the most commonly used antiseptics in the OPDs. You need to remember. Okay. Iodine, hydrogen peroxide, ethyl alcohol. They are always available in any of the surgical OPDs or in the emergency department. Okay, these things are commonly used. Okay, then we have tincture iodine. Do you know hydrogen peroxide, iodine, and alcohol all have similar mechanism of killing the bacteria. So all do their action by oxidizing the bacterial membranes. That's why they are called as oxidizing agents. They generate the free radicals by which they kill the bacterial cell wall and kill them. Okay, iodine, hydrogen peroxide, alcohol, all are oxidizing agents. Okay. So hydrogen peroxide, potassium permanganate. I have seen this crystals, potassium permanganate crystals. Okay, they provide dark pink color. Then we have peracetic acid also. So the drugs which counter the bacterial cell membrane, we have this ionic surface active agents, chlorhexidine. Have you seen the latest advertisements in the TV which contains Listerine mouthwash? Okay, suddenly something happens in the advertiser's mouth. Okay, complete freshness will be there. I've seen those advertisements. So what is the preparation? It contains chlorhexidine. Okay, they are popular mouthwashes. Okay, then cetrimide again is a part of this phenol. Okay, this floor mopping also, and cetrimide is also part of the liquid solutions, antiseptic liquid solutions. Then we have cetyl pyridine chloride, benzalkonium chloride. So have you eaten strepsils? Yes? No one? Anyone not eaten? Strepsils, copsils, okay? They contain this benzalkonium chloride. That means we actually consume it at very low concentration. Okay? So they help in throat infections, throat pain and all. Okay? Benzalkonium chloride, they are part of this strepsils and all. We should see out of curiosity what it contains, strepsils. Other than sugar, because they are sweet, they also contain something like benzalkonium chloride. Okay, then we have this miscellaneous agent such as dyes. Nowadays we are not using this junction violet, acrylamide and everything. But previously you might have seen in the village side and skin department, they use this dark blue color solution to treat the wounds. Have you seen? Applying this dark blue color solution. It's something. It appears like something you have poured the ink on the surface. Staining, completely bad staining will be there. Okay. So that was used previously. Nowadays we avoid it because of this staining. Okay. Carom board. So what is the powder we use to move the ponds faster? Boric acid. Okay. So boric acid is also an antiseptic. So this nitrochlorozone, nitrochlorozone and boric acid. So I have just told you some examples where these drugs can be used. So now we will learn something in specific about this aldehydes such as formaldehyde. Okay, formalin, the bad pungent odor which you get from the anatomy department is formalin. Okay, so formalin, it is 37% aqueous solution of formaldehyde. That we call it as formalin, used to preserve dead bodies. Okay, so have you heard of embalming? So embalming is done with the help of this. Why do they do this? In order to preserve the body for longer time. You know, some high-fi person has died and the body should be shifted to other place, or the lot of fans are there, they have to see the body, everyone has to come from long distance, 2 to 3 days they have to keep the body. What they do embalming. So the drugs used here are the formalin. Okay, so 4 to 5% for preserving the dead tissue, and to deplete that we are using 37% aqueous solution. Pungent odor, sensitization. What will happen to the eyes? Complete irritation. Okay, they are strong irritants. Even the hands, eyes, everything will be burning after 1 hour of dissection. So then we have this glutaraldehyde. We told that they are immersion disinfectants. That means the surgical instruments can be dipped there after using. Then you do not have time for autoclaving the top. Okay, so glutaraldehyde is the drug used there. So then we have phenols. So phenol we have cresol, lysol and chloroxaninol. Okay, chloroxaninol again it is a part of this oral mouthwash preparations. Okay, so cresol is a mixture of ethyl alcohol, is a surface disinfectant. Okay, the negative point we need to remember, sometimes they cause corrosion of this iron instrument. That's why they use steels. So chloroxaninol is a non-corrosive agent. Okay, that will be used on steels. Then the most popular liquid antiseptic which most of the homes have, that is Dettol. What it contains? Dettol. It contains 3 things: chloroxaninol, 9% alcohol and alcohol. Okay, so Dettol, the most common drug, which is the most common preparation which is used, contains 3 things. Okay, you can remember it as CAT. C for chloroxaninol, A for alcohol, T for tapinol. Okay, then we have phenol, that is eugenol. Eugenol is a antimicrobial and analgesic agent. Okay, so less commonly used drugs, except chloroquine, we can accumulate in the skin, and for the wound infections we can use this. Okay, cutaneous absorption. If it is used for a longer time, it can cause neural toxicity. So triclosan. Have you seen this preparation anywhere? Triclosan. Most of the toothpaste contain triclosan. Okay, today you go home and search for this triclosan in your toothpaste. Any toothpaste you use, the Okay, except for the Ayurvedic Patanjali preparations, which we don't know what they contain. But except for that, most of the preparations whether we go for C or B. What is C? C for Colgate, P for Pepsodent. Okay, the most commonly used one. Okay, anything you use, most of them should contain triclosan only. Okay, whether it contains salt, charcoal, all preparations you might be seeing nowadays in the TVs. The basic ingredient should be triclosan. Okay, they have this anti-inflammatory property. Then we have this alcohols, ethyl alcohol and isopropyl alcohol. Okay, most of the doctors used to try to sterilize their hands after touching the patients with alcohol. Why? Because easily it evaporates. Fast, no need to go to the water, wash the hands. Okay? Simple, easy. But at the end of the day, you need to go for this soap and water. Then you can also use it for cleaning the wounds also. Okay. So here you can see that we can cover both gram-positive, gram-negative, tubercular, bacilli, viruses, fungi. But the negative point is they are not sporicidal. Okay. So that's why final thing will be soap and water. So what they can cause? Alcohol. If you put it in the eye, if you spill it on the eye, they can be coronary tissue damage also. Okay, mucous membrane, and they can cause ulcers. Okay, so heavy metals such as iron or salt, silver nitrate eye drops, silver sulfur dioxide. Have you heard of this? Preparations used for burns. What will happen in the burn? Irritation, burning sensation will be there. There we need an agent which can cool those burns. The best agent will be silver sulfur dioxide. Okay, so silver is acting as a cooling agent. Okay, cooling agent, and sulfur dioxide is an antibacterial agent. That's why we use silver X ointment. Okay, silver X from grandparents, most of the time they use it, and the popular preparation is Vernon. Most of the time they should contain this silver. Okay, silver sulfur dioxide. So coming to the zinc salts, we told that zinc nowadays occupies most of the preparations. Okay, maybe the antibiotics nowadays, ofloxacin, ornidazole, and also they contain zinc preparations. ORS, now zinc based ORS are there. Okay, zinc, if you tell top to bottom, all uses are there. Okay, they can help in hair growth, they can help in the complexion of the skin, where you use it for calamine lotion. We told that zinc paints are available, okay, for mouthwash. Then we told that for GI infections, that as food poisoning we are using antibiotics. ORS we are using zinc. Okay, now we can use zinc preparations for stomach wash, everything. Okay, so zinc nowadays can be used for most of the things. Zinc sulfate eye drops are available. Zinc salts have mild antiseptic property. Zinc oxide we told that is the part of this lactocalamic lotion also. Okay, so zinc preparations are most commonly used now. So then we have this inorganic and we can add on inorganic and organic also. Mercurochrome, that is less commonly used, weak antiseptic, and nitromycin we have again is the bacterial antiseptic. Have you heard of this term nitrofurantoin? Urinary antiseptics. Okay, so nitrofurantoin is the urinary antiseptic. Come to the next group, iodine, povidone, iodine. The preparations which contain iodine are called as iodophores. Okay, maybe Mandel's paint which contain iodine, which can be povidone iodine. Have you heard of Lugol's iodine? Again, Lugol's iodine is a preparation which is used for thyroid surgeries. Okay, before thyroid surgeries we use this Lugol's iodine. So many preparations of iodine are present. And basically, what is the character of this iodine preparations? They are oxidizing agents. Okay, all three of them we have discussed. So 1:20,000. Okay, such low concentration will kill the bacteria. Okay, it is near ideal disinfectant. That means lesser side effects and more positive effects. Okay, so only negative point is discoloring of the skin. Have you heard of this Iodex? Where do we use it? It is a surface irritant or the counter irritant agent which is used for deeper-seated paints. Okay, Iodex's preparation is rubbed on the skin so that the deeper paints are used. We call them as surface irritants or the counter irritant agents. Okay, so then we can also use this preparation for disinfecting the ulcers and also for endoscopic instruments. That is very important. Nowadays, most of the surgeons they do with low scalpel surgeries. That means they most of the time they use this endoscopy so that faster recovery is there for the patient. Then coming to the preparation which contain chlorine. We told that water disinfection, the road end contamination disinfection, DDT, all this. Okay. Have you heard of this DDT? Yes? Yes. What is this DDT? Long term. Dichloro, diphenyl, trichloroethane. Okay. DDT is a preparation which is used for preventing the mosquito-borne diseases. Okay, on most of the water bodies where the mosquitoes lay their eggs. Do you remember the mosquitoes which bite on the day and causes disease? Dengue. Okay, dengue mosquito bites in the daytime. The mosquitoes which bite in the night time cause malaria. Okay, it is not compulsory that they should bite in the daytime or they should bite in the night time to cause malaria. Okay, it is known that most commonly the mosquitoes which cause dengue are biting in the daytime and the mosquitoes which cause malaria they are biting in the night time. Okay, but the mosquitoes don't know that. Okay, they can bite anytime. So here is the one chlorine. Okay, we can use it for disinfecting the drinking water, sodium hydrochloride solution. Again, here the nascent oxygen is there. Okay, that will cause the killing of this bacterial cell membrane. Then we have the stacking solution for surgical instruments. Okay, surgical chlorinated soda solution. Then chlorinated lime. Okay, bleaching powder. Where is this bleaching powder? Bleaching powder for water disinfection. Have you heard of this washing soda? What is that washing soda? Sodium bicarbonate. Okay. So then we have this Chloramine-T. Again, it is used for water disinfection. Okay, less irritant compared to them. Okay, stable skin. It can be used for skin antiseptics also and also for treatment of the drinking water. Okay, nowadays we have large plants. Okay, large water plants for disinfection of villages. You might have seen the large plants at every village. It is that awareness has come rather than going for chlorine, because previously the did not have enough finance to do this large water disinfection plant at every village. But nowadays they are planning for this large water disinfection plant. Okay, so after this municipality water purification, now they have large plants in every areas. Okay, you might have seen a large steel vessel kept in a glass chamber. Okay, so previously they used to use this small DDT, Chloramine-T, okay, bleaching powder and powder. Now coming to the most commonly used oxidizing agents. We told that potassium permanganate, perchlorate, hydrogen peroxide, povidone iodine all have this oxidizing property. But specifically we are using this hydrogen peroxide. Okay, what do you see once you put this hydrogen peroxide on the wound? A foam-like thing will come. What is that foam-like thing? That is due to the rapid destruction of the cells. Okay, due to the rapid destruction of the cells, you see a foam-like thing which is coming out. Okay, that you should know that it is hydrogen peroxide. Okay, so broad spectrum, germicide, cleaning tools, abscesses, remains the most commonly used. Okay, so next we have for acetic acid preparations. Okay, so acetic acid it is used for this food preservatives. Okay, so we also use radiations. Okay, they are packed in a plastic cover, then radiations are passed. Okay, laser radiations are nowadays used for this food particles. You might have seen the packed cakes, packed food materials, kurkure, chips, all these things. Okay, they use laser treatment also. So then we have this potassium permanganate, KMnO4. Okay, you know this KMnO4 was carried by the ancient travelers. Okay, what they used to do, you know, this crystals they used to carry. Wherever they go, they would have some water. Okay, they don't know whether this water is good for drinking or not. So they used to put some crystals of this KMnO4. That would help them to consume the better water. Some wood they get. Okay, for that wood they used to put this crystals, potassium crystals. Okay. They use a specific term for this, using this potassium permanganate crystals on the wood. Okay, so they can kill the bacteria on the wood also. They can purify the drinking water also. You know, swimming pools, have seen the swimming pools. So many times what they do, they have to clean the body before going to the. They have to take a bath before going to the swimming pool. So because swimming pool borne diseases are prevented, and there they use a small pond, okay, which can just immerse your foot. There they should put this potassium permanganate. That's why the fluid there will be pink color. Most of the time they don't follow, but ideally if you go to the star hotels or the, you can see that. Okay, so small pond is there, where only foot is immersed. There they put the potassium crystals, so they can be used for swimming pool disinfection also. So then we have come to the next drug, Savlon. Okay, what is the difference between Savlon and this Dettol? Which is less irritating? Savlon is less irritating. Okay, Dettol causes pain. Okay, painful irritation and all. Savlon is better than that. Okay. So chlorhexidine and citramide are used. Have you heard of